With so many methods and techniques for treating scoliosis that you can find on YouTube and pretty much anywhere else, how do you decide what to use to treat your scoliosis? Hi, I'm Dave Butler. Today I'm going to talk about the top 3 reasons that you should include the Schroth Method in your scoliosis treatment. Okay, I've been a Schroth trained physical therapist for the last 11 years. And over those 11 years, I've seen some great results with the Schroth Method. And I also use other techniques, including the C's approach and general strengthening and things like that. But I wanted to go over 3 reasons that you should be using the Schroth Method to conservatively treat your scoliosis. And make sure you pay attention to all 3, because I think all 3 talk about specifically why the Schroth Method is a great method for treatment. It's not the right method for everyone, so that will be the topic of another video. Which scoliosis curves is the Schroth Method not right or not correct for treating? The majority of my patients I treat with the Schroth Method. So let's go over the top 3 reasons that the top 3 reasons that I think you should incorporate the Schroth Method into your treatment program for scoliosis. Number 1, the Schroth Method is a 3-dimensional treatment, where scoliosis is also a 3-dimensional treatment. So if we talk about 3 dimensions, real quick, we have 1 dimension, which is the scoliosis curve that most people think about. It's the curve, the Cobb angle, the curve that is the degree that is measured of your scoliosis. So that's 1 dimension. We have a rotation that happens to the convex side of the scoliosis curve. That's a 2nd dimension where we have rotation. That's where when someone is bending forward, you're looking to see if one side is higher than the other because of the rotation. That's actually how most of the time scoliosis is detected. So that's the 2nd dimension. The 3rd dimension is normally with scoliosis we'll either have a flat back or a straighter kyphosis or upper back, or we'll have an increase in kyphosis. Usually it's a flat back with that. So that's the 3rd dimension. With the Schroth Method, we address all 3 dimensions of the scoliosis. We're not just looking at the scoliosis as the Cobb angle and stretching the concave side and strengthening the convex side. That is not the way to treat scoliosis, and it's not effective. So the Schroth Method is a 3-dimensional way of treating scoliosis. So that's number 1 reason that you should be using the Schroth Method to treat your scoliosis. Number 2, the Schroth Method is designed to be individual to each person's curve. We do categorize different curves in different ways. So we categorize whether it's a thoracic or a lumbar or where the pelvis is, but each curve is different and each curve needs to be individualized in how it's treated. So we can't just treat a right-sided thoracic curve the same all the time. It has to be specific to what's going on with the thoracic spine and the lumbar spine. And the Schroth Method makes this very easy to individualize treatment and make it specific to each individual curve. So that's number 2, that the Schroth Method is specific to your curve and you'll learn exercises specific to your curve. Reason number 3, the Schroth Method has been around for a long time. It's been around for over 100 years. It was developed, I think, in the 1920s by Katarina Schroth, and it's been used in Europe and Germany and other places for a long time. It came to the US, I think, in the late 1990s, and it's been used for a long time. It's been changed over that time and modified to get the best results possible. That isn't the number 3 reason. The number 3 reason is that it's also the most researched method for scoliosis treatment. If you look at current research for scoliosis, you'll see that the Schroth Method is the overwhelming favorite for research-backed treatment in the scoliosis conservative realm. So it's been researched the most, it's been found to be effective, especially when combined with bracing and strengthening, and I think that is a really good reason to include it in your treatment for scoliosis. And those 3 reasons made me get trained in the Schroth method when I started my practice. And the Schroth method has been a main part of my practice, and most of my patients do the Schroth method, at least in some part. There are some things that would make someone not a candidate to do Schroth. Sometimes they're too young. Sometimes they're not able to do the exercises. Sometimes mentally they're not able to. But we'll go over that in another video so that you know if the Schroth method is right for you. But those are my 3 reasons that the Schroth method should be included in your conservative scoliosis treatment approach. Number 1, it's a 3-dimensional approach. Number 2, it is specific to your curve. And number 3, it's the most research-backed conservative treatment for scoliosis that we know of today. There's a lot more research coming out on different techniques, but the Schroth method still takes the cake as far as the most research. So if you're looking for someone to help you with the Schroth method, here at Align Therapy, we've been doing it for a while. All of my therapists are certified in it, and we'd love to see you. At the very least, like this video, subscribe to the channel so that you can see other information on the Schroth method and get the treatment that you need and deserve for your scoliosis. Thanks for watching. We'll see you next time.